Hi, so Sally Greenwood. I'm sure lots of people know who you are, Sally. It's lovely to see you today.
You too, you too.
So, for those that don't know Sally, Sally is a partner, husband and wife team, has been doing or been involved with private medical insurance for nearly 12 years. So, Sally, can you tell me a little bit about what you did before you got into, or how you really got into health insurance?
Yeah, I mean, basically my history was as an accountant, so was Andy. And he actually got made redundant from the BBC. He'd been there for 26 years. And like a lot of people, redundancy is a real opportunity. And I was lucky enough to get a year's career break from my job. And we decided to go travelling for a year. So we sort of packed up the house and off we went. So quite old to be doing a gap year, but it was brilliant. Absolutely brilliant. And I think when we were away was when we sort of thought, actually, you know, we've had an opportunity like this. What do we want to do when we get back? And it wasn't what we were doing before, but we didn't know what we wanted to do. So basically, cut a huge long story short, went to the British Franchise Exhibition. We were looking at all sorts of things like travel, franchises, all that sort of thing, and met the people from WPA there. And in a million years, we would not have said, oh, we wanted to be doing health insurance. But when we met the people, they were really good. They were looking for business people, not salespeople in any way, shape or form, which we weren't. We're not, but that's what they were looking for. And it was a not-for-profit company, which we liked.
Yes.
You got a mentor for your first 2 years, and you got all the support from head office, like all the compliance and the training, which was really good. So that we then thought, yeah, and we wanted to work together because we'd gone away for a whole year together. We hadn't. We thought
it's still together, yeah.
We're still together. So we thought it can't be too bad. And that's what we did. And that was, just over, we're in our 12th year now. So
yeah, that's amazing. I mean, I know what it's like working with your husband, having worked with mine for 10 years, and to work together has its good points and its bad points as well. But Andy's lovely, so I know you make a great team. So in terms of WPA, what does the company offer? I know I'm actually a client and have been a client of yours for, I think it's 10 years now.
I think it is, yeah.
I know, that's scary. And they have been absolutely amazing through COVID-19. But what I know they do cash plans and company plans, or do all sorts of things. And actually, it's not, people think private medicals, it's too expensive, I can't do it. But that's not the case at all. So I know that's a lot of questions to ask you.
No, that's fine.
Just give me a flavour.
As you say, we do cash plans and what I call full health insurance. And a cash plan it's an inexpensive way of getting cover for certain essential things that you'd use, like going to the dentist, the optician, a little bit of money to see a consultant or a specialist, and money to see therapists like your physios, your osteos, and things like that. So it's a different sort of plan. It's a very usable plan, and most people do, certainly get their money's worth out of that. And you can add on various extras. And it's great for individuals, and it's also great for companies as a staff benefit. It's a very inexpensive staff benefit, but it's got so much on it that staff can use, even for things like eye tests, which quite often the company has to pay for. So that's the cash plan, and it is cash limited. But the full health insurance, there's a lot of options in that. The basic premise is that, say, you go to your GP says you need to see a specialist, and that's when health insurance generally starts to kick in. And obviously there's so many different types of plan, I'm talking very generally.
Yeah. So,
and then again, if you need to go to hospital for an operation, that's when health insurance really works. And I think overall it gives you is choice. You can choose which hospital, which consultant, what time of day you go, which is really important if you've got a family, if you're running a business, and you can go for an appointment at 8 o'clock in the evening, rather than waiting for a letter and then suddenly finding out, you're on holiday that week, and
or it's been cancelled.
Exactly. Yeah.
And I think now, certainly now, obviously with the NHS having had to redirect everything to COVID patients, the waiting lists are humongous, aren't they?
Yeah, they're going to be absolutely, yeah.
So in terms of, I mean, I know, for example, in the policy that we've got, you know, every year we buy new glasses, we have contact lenses, we claim for all of our dental appointments and that type of thing. I've had breast scans and all sorts of things through the company. So, you know, it's really worth looking at it. And I think people do, you know, ask the question, speak to Sally or Andy, because you know, there are lots of different plans to suit everybody. But what were the key things? What have you found over the last 3 months that you think, you know, makes WPA stand out from some of the other insurance companies?
I think, well, from my point of view, my customer's point of view, in a way, for mine, when all this hit, it was like, oh gosh, everyone was in the same boat. They were like, oh my goodness, what's happening? WPA was straight on it almost immediately with what they could do to help people that had problem paying, and offering different options that would help out so they wouldn't lose their cover. They brought out the remote GP benefit early. They brought out a health and wellbeing benefit early, which helped with some counselling and stuff like that. So they made it really easy for us because we had things that we could tell people. You know, we were spending a lot of time dealing with actual current customers who were worried about things, and we had things that we could offer them because WPA had made that really easy. And I think that the GP benefit has been amazing. I've known quite a few people now that have already used it. It's just brilliant. You don't have to go to a GP surgery at this time that a lot of people don't want to. And it's been really successful, quite quick to get an appointment or speak to someone.
Yeah, that's really good. I mean, I think not so long ago when GPs started doing telephone consultations and rather than coming down to the surgery, I used to think, oh, that's a bit weird, not having to go and see them face to face. But now doing appointments over Zoom where you can show them your problems. I mean, I suppose it's just a different way of getting used to things, isn't it? But the fact that you can just dial into this separate services is brilliant. And also,
I think it's the way. Oh, sorry. And I was going to say, I think it's the way, in a way, going forward. It will never completely replace it. I get that, but I think going forward, a lot of things are going to be more remote. Particularly, I think they call it the patient journey. That there's a whole number of steps that someone takes on a patient journey, and if a few of those can be, you know, taken out, like you don't have to go and see a consultant 4 times. One of them might be a remote one. It does sort of make sense. It's getting used to it. So.
The thing that I really was impressed with was I've had numerous emails from WPA, and more recently over the last well, actually just I think it was yesterday or the day before, a second email saying that I'm getting a payment back because obviously I'm not being able to access the services, or as many of the services maybe, and they've just given us money back. I'm like, without even asking. Happy days.
And that was another thing that they brought out very quickly. And again, it is a not-for-profit company, so their priority is the customers. They're not interested in paying shareholders or anything like that. So that was the fair thing to do. And they're continually reviewing it to see what they think is fair, and doing it like that. But we've had our refunds as well, and it's just nice, isn't it? As you say, to not have to ask for it.
Yeah, great, great. I wish more companies would have done that. Travel insurance. Okay, you know. So in terms of contacts, I mean, clearly you're looking for people who either haven't considered medical insurance before, or maybe have a policy that you can, you know, look at and compare, or companies that may be looking for this as a benefit for their staff.
I think, actually, you've covered all 3 really, and I think particularly with the companies, because the company cash plan is a very low cost benefit, and I appreciate completely money is tight everywhere now. But the number of benefits it gives, including employee assistance programs, you know, all that sort of stuff, I think is a really useful benefit. And I won't say what the prices are on here, but it's a lot
on the individual,
But I'm more than happy just to talk, because obviously if people don't really know much about health insurance, I'd be really keen to talk to them, because I think one of the dangers is sometimes think, okay, I'm going to have this, I'm going online, this is cheap or whatever. But there are a lot of questions to ask, and I think it's really important to sort of know what you're buying, because it may be appropriate for you. You know, someone might have so many pre-existing conditions, it wouldn't be value for money. But if they understand that, they can make a decision based on what they know would and would not be covered, which is also really important.
I think coming back, really, the thing that you said at the very beginning was that you and Andy are not salespeople, and therefore, you know, you are not going to sell a policy to somebody. And you've just said, you know, it really does depend on the individual. So I can you know, second that Sally is, you know, will talk to you and find out what, you know, and give you good value and good advice, really, rather than sell to you. So in terms of how can people get hold of you guys?
Right, okay, well, I'm on email, which is sally.greenwood@hcp-plc.org.uk. The website address is wpa.org.uk, and then I always call it hyphen / one of those, Andy Greenwood. And my mobile is 07838 702 894, and my landline is 01438 869 705.
And actually, if you move slightly to the left, I can see all of that behind you. So look at the video. Oh, brilliant. It's so lovely to talk to you. I know it's just a snapshot, but can highly recommend WPA. So
thank you.
And Sally and Andy as well. So lovely to talk to you today, Sally.
Yeah, thank you. Brilliant.